Hi, everyone. Welcome to the Dog Allergy Summit. I'm super excited to be seeing you for our launch party. I've got some fantastic guests that I'll be introducing you to in just a minute. But first, a little bit about me. So I'm Dr. Alex. If you've not kind of checked out any of my kind of stuff previously, I'm a veterinarian in general practice. I'm founder of Our Pets Health. I have a YouTube channel, podcast, all kinds of things online. But really my aim and my desire is to bring really high quality information that's actionable, that helps pet parents help their dogs, just like your pets at home, to live as happy, as healthy, as full lives as possible. And that's why I was super excited to be producing this allergy summit and get to talk to the huge number of experts that I've spoken to over the last wee while, and who I'll be bringing their expertise to you over the next few days. So really excited to be jumping into the next few days as a whole. But for now, let's introduce our guest today. So first up, we've got Dr. Cherice Roth. So she's from Oregon and is currently the Chief Veterinary Officer of Fuzzy Pet Health, as well as Special Programs Coordinator of the Multicultural Veterinary Medical Association. Dr. Roth is also an author of children's books that focus on veterinary medicine, diversity, and representation. And she believes that veterinary virtual care is the answer for health disparities in pets, as well as part of the answer to the psychological issues of veterinary professionals. So Dr. Cherice, it's a real pleasure to be talking to you again today.
You as well. Nice to see you again.
Fantastic. We've also got Jed Davis. So he's joining us from Idaho, and he is the president of PoliPet Products, who are a company specializing in helping canines with research-backed products and innovative science. As a certified canine herbalist and master's graduate, he spent years researching, training, and challenging the status quo of the pet industry. And he enjoys the passionate pursuit, which is a bit of a mouthful, of a better future for our dogs through science. So Jed, really great to be having you along today.
Thank you for having me.
Cool. And then next up, we've got Dr. Jeff Werber, who joins us from LA. Dr. Jeff is an Emmy award-winning, nationally renowned veterinarian who's been practicing for 38 years. He's the founder of the prestigious AAHA certified Century Veterinary Group in Los Angeles, California, Veterinary Economics Merit Design Award-winning hospital. And he's also the president of Dr. Jeff Enterprises and continues to see his patients at Value Vets in Westwood. And you've just been dealing with clients today, so it's really great to be seeing you along as well, Dr. Jeff.
Thanks, and great to be here. Great to be here.
Fantastic. And then last but by no means least, we've got Dr. Joya Griffin. So Dr. Joya joins us from Louisville in Kentucky and is the star of National Geographic Wild and Disney Plus's hit show, Pop Goes the Vet with Dr. Joya. She's a veterinary dermatologist who graduated from Cornell University College of Veterinary Medicine. She completed her residency there as well and joined Animal Dermatology Clinic. She enjoys treating allergic disease, ear disease, immune-mediated conditions, and all things poppable, which is just fantastic. So welcome along, Dr. Joya.
It's my pleasure. Thanks for having me.
And I'm really upset that I have kept trying to see if they have got your show in New Zealand, but not yet, but hopefully soon. I know it sounds good, and I love all things poppable as well. So that's our expert kind of panel today. Super excited to be jumping into kind of their top tips and discussions of kind of what our conversations, our longer conversations were, to give you some nuggets and sneak previews. But I guess from a first point of view, why allergies? Why is it important that we've got all of this information, that we've got all of these fantastic speakers coming to you over the next few days? So for me, it was kind of a no-brainer when the Allergy Summit was suggested as a topic to me, because allergies, they're just so common. You know, they're thought to affect 20% or so of dogs at some point in their life. They are frequent causes of misery and a reduction in quality of life. They're a chronic condition that they kind of bimble along. They get slowly worse. We get dogs that are effectively painful. They have poor sleep. They're just miserable, and they're definitely not living their best life. And given it's so common, you know, I was really excited to have this opportunity to talk to you about this topic. Also, it's a disease where there's no simple one-size-fits-all strategy. There's lots of different options out there, and while lots of those different options can make a real world difference, and the more that we do, the more difference that they can make, there are definite hurdles, there are definite pitfalls to avoid, and there are common mistakes that we'll all see on a very regular basis for those of us that are seeing dogs with this condition. So that's really why it's so important to be, you know, turning up, to be watching all of these, to be taking notes, and to be joining in the Facebook group and everything else that's going on. So with that, kind of higher level out the way, let's jump into the conversations that we've been having and a little bit of a kind of sneak preview, if you like. So, Dr. Cherice, kind of we had a chat about non-antibiotic methods of controlling allergies, as well as veterinary mental health. Did you want to let us know a little bit more about those two topics?
Yeah, absolutely. The biggest part of this is that using antibiotics is something that we used to do quite a bit in the past, to the point that we've started to really see antibiotic resistance, not just in our furry friends, but also in our human counterparts, the pet parents that take care of these guys, and in our food animals. And so in order for us to be more protective of those resources, the ability to use antibiotics, we really have to be protective of. And so really what we went through, Dr. Alex, you and I, is we talked about methods that can effectively treat skin conditions, specifically skin infections, without the use of antibiotics, and how to really keep control of that itch, of the smell, all of those sorts of things without having to reach for antibiotics if it's at all possible. We also had the pleasure of talking about just veterinary mental health. It's something that I'm extremely passionate about, because if we continue to lose veterinarians at the rate that we're losing them, we won't be able to provide excellent care for these animals that we love so much, particularly our dogs. And so we talked through a lot of strategies around why having boundaries in veterinary medicine are so important, what those boundaries may look like from a pet parent's point of view, and then other options like veterinary telehealth to help fill those gaps so that veterinary health providers, nurses, and doctors alike can get the time that they need to recharge, reset, and to be able to repair the pets when they need to.
Yeah, absolutely. And I mean, that's a topic that's very close to my heart. And I was reading recently that actually a lot of pet parents, they're not wanting to contact their vet because they recognize how busy we all are, and actually that telehealth. And then from the antibiotic point of view, that's such an important topic, because antibiotics definitely have a role, but with that increasing resistance, there are other options that are just as effective. And I think from memory, we go through a lot of different kind of very affordable options as well, depending on kind of people's budgets and that kind of thing.
Yeah, that's exactly right. The affordability piece, as we're starting to see real economic impact of what the pandemic has done, we don't want to compromise care for our pets. We want to do things that are effective, that are safe, and honestly, that sometimes can be a better option than the normal go-to of oral antibiotics in general.
Yeah, absolutely. And at this kind of current time in the global situation, I think no matter where you're watching this in the world, there's going to be price rises, and fuel costs here are through the roof, and food costs, and it's a struggle. So it's great to have some of those options. Fantastic. Thanks so much, Dr. Cherice. Jed, so you're talking to us, and you're giving a presentation about certain kind of toxins and things and their role in allergies, aren't you?
Absolutely. So PoliPet, our presentation, we're going to deep dive into heavy metals, environmental toxins, foreign substances that can get into a dog's body that can cause these allergic reactions. As you said, there's a lot of different sources for allergies and a lot of different ways to treat them. We're not here to suppose that our products or even heavy metals and toxins are the root cause of the majority or even a large portion of these allergies, but we do want to educate and inform so that everyone knows that this is a possible source, that there are certain things that we each do with our dogs every day that may be introducing these foreign substances, how to recognize them, the symptoms, how to remove them. And ultimately, we want to educate and inform so that everyone begins to understand that there's still just a lot that we need to learn in this space, but there's also a lot of published studies and research that we can use. We feel a responsibility as a supplement company to begin to elevate the standings of those companies. There's a lot of claims out there. We see the ads every day in Facebook and Instagram. They simply can't all be true. It's just not possible. So everything that we're going to present and talk about, we'll have a published study or report to back it up, and hopefully be able to help people so that they can figure out how to remove these if they are the source of those allergies, as well as strengthen their pet's overall health.
Yeah, I love that. So I love several aspects of that. Like I'm a big believer in following the evidence, and that, if we're making wild claims, we need to have, some evidence to back it up. And unfortunately, some claims are contrary, complete opposite of what the evidence, suggests. But also, I guess your message there of that, these might be a potential cause, although they're not a very common cause. So it's very easy, some of this messaging, to say, well, actually, this is this is really important, and overemphasizing the frequency which that happens. So that's fantastic, Jed. I'm really looking forward to to checking in on that presentation and checking out what that has to offer our pets. And then Dr. Jeff, back to kind of basics, how we go about kind of making that diagnosis, and then kind of some of the medical treatments, and maybe addressing some of those concerns that people had.
Well, again, as you discussed and Dr. Joya mentioned, we have, so many types of allergies, so many different things, and it's customizing the treatment specifically to try to eliminate the allergen if you can. Understanding, for example, on dogs are great, unlike cats. Not that their cats aren't great, because I have 5 of each, but at least when we're dealing with dogs, you can look at a dog and you have a really good idea of what the allergens are based on the distribution of the lesions, where they are. You see, if a dog comes in and there, you can see all the scabs and sores and thinning hair around the rump, the lower back of the rump, I will find a flea. And there's no doubt. And I'll sit there and go, what are you looking? No, we looked, they have no fleas. Oh yeah, no, this is a sign that says fleas were here. And so we can look, find them, inside the groin, underneath the belly. I'm thinking what we call atopic dermatitis, most likely some sort of pollen, some environmental allergen, and also the importance of some of the overlap. For example, ears. I see ears, I see front feet. I'm thinking, well, chewing at the feet, I'm thinking of food allergy. Ears is kind of overlap because atopic dogs also have ear disease and ear infections. So you get some clues, but not always. And interestingly, food is overrated. When you think about the percent of dogs that actually have pure food allergy, it's not as much as people think. I'm curious, Dr. Joy, what you think, but I've been told maybe 10 or 15% of allergies are food related. So it's very important to know these things, and also look at your seasons. If you have a dog who's only having problems during spring and summer, and you don't change your food during spring and summer, it's not food. It's very easy. You got to look for something else. So there's so much that the animals tell us just by nature of the seasonality, the location of the lesions, how badly they're scratching, are they scratching or not? You can have a dog with some skin lesions that's really not that pruritic. And I'm thinking, well, maybe we should do some skin scrapings and impression smears because I'm looking for something else here. So I think that it's really important to know the variation of things, what you can do to hone in on an accurate diagnosis, because once you have your diagnosis, it's a lot easier to treat. And if I know pollens are the key, I'm going to recommend possibly, and again, trying to avoiding some of the drugs. Let's maybe talk about having some sensitivity testing, and let's get some allergy testing. Some of the companies now have made it so easy for us as veterinarians, general practice veterinarians, that we don't need, no offense, but we don't need just a specialist anymore. When it was down to skin scratching, I mean, when I graduated vet school a lot of years ago, we had no choice other than you send them to the allergist, to the dermatologist, because they would do the scratch testing. Now we have some other options, makes it a little bit more convenient. So though I still think, maybe I'm wrong, that scratch testing, the skin testing is the gold standard. But the blood test is a lot easier. So
it sure is. But there's a few pitfalls as well, though, because although some of the tests are quite easier, there's also some tests that are so easy as to be useless. And maybe we'll leave that there, because we'll we won't spoil that surprise. But there's definitely making that diagnosis is so important, and it's not as easy as we might think. So that's fantastic, Dr. Jeff. Now, Dr. Joya, we kind of get a little bit more practical into kind of a bathing and topical therapy tips.
Yeah, absolutely. So about the different applications for topical therapy, which of course everyone thinks of bathing, but there are some topical therapy things that you can do at home that are a little bit more user-friendly. I think I hear every day from my pet parents that they think that they can overbathe their dog, and so they're told not to bathe their dog too much. And when they come into my practice, I'm saying, no, actually you need to bathe more frequently, especially if you have infections like Dr. Roth alluded to. There are a lot of non-systemic therapies for treating infection, especially when we have resistant infections. We may not even have a systemic option available to us that's practical or safe. So I utilize topical therapy in almost all of my allergic dogs, and I will find what best fits each individual patient. So it's not always bathing, because some animals can't be bathed, and or their pet parents can't bathe them for health reasons. Maybe it's a 200-pound dog that can't be lifted, all kinds of things. So I try to tailor each routine for that specific family. If they can't bathe and put them in the tub, then we can also do wipes, mousses, sprays. There's so many things that are out there, and they help to do multiple things, remove excessive bacteria and yeast from the skin to help prevent infection. We can also restore moisture to the skin and restore that barrier function of the skin, which is so important in allergic dogs, because we know that they have barrier dysfunctions, which make them more prone to allergic flare and more prone to infection. So topical therapy has many applications, and I think is super, super useful in our allergic dogs and cats. And cats, I say, because cats can have topical therapy done on them too. Most
they can. I saw a cat in the clinic yesterday, and the owner was telling me how all of the scratches on her arm that I was seeing was because she'd bathed her cat. Long haired cat with a bit of diarrhea, so not allergic, but you can,
okay.
can't you? Absolutely. And I guess the topicals, it's maybe often overlooked, or the importance of choosing the right product as well is overlooked. And it's to think of, well, any shampoo, any topical is much of a muchness, but that's really not the case.
Right. Ingredients are definitely key, and there are some products that really are best found at your veterinarian and with their assistance than getting some of the over-the-counter products, because a lot of times they don't actually have any active ingredients in them that are going to be that helpful. They may be good for grooming, but for actually treating infections and having the fatty acids and ceramides involved in them to restore the barrier function of skin, sometimes they're lacking in those. So it's best to get a veterinarian's recommendation, I think, first, and then find the best product for your pet.
Yeah, fantastic. I guess that touches on a lot of the reasons why I wanted to do this as well, and that marketing, and as Jed said, kind of the Facebook algorithm, as soon as you've got that pixel and you get hit with all these adverts, it's very easy to be taken into these products that have got no active ingredient, or are poorly produced, or just aren't based on anything that's ever going to work in the first place. So Dr. Joya, that's fantastic. So that kind of moves on to our next section. So I've got a bit of a case study, if you like, if you're all game for playing along. So our fictional dog, but I say fictional, I'm sure we will all recognize this as a client or a patient of ours. So we've got Molly. She's a 4-year-old Bichon. She's been getting progressively more itchy over the last few months, and now she's keeping mum and dad awake at night with her constant scratching. So she's getting no sleep, mum and dad are getting no sleep, and they're putting their foot down and recognizing that they need to seek some professional help. She's been a little bit itchy for kind of a few weeks last year, so it's something that she's kind of had for a long time potentially, but it's getting worse. Her owners, they've tried a few different solutions. They've kind of reached out online to forums and all that kind of thing, but nothing's really made the difference that's let them have a good night's sleep. And so they've brought Molly to see you for the first time. She's not seen any other vet. Maybe Dr. Joya will go in reverse order. What are your thoughts on this? This case of if Molly walked through your door.
Right. So I think Dr. Jeff spoke to a lot of this. Diagnosing what actually is going on is key. So your history and physical exam are very important. And if I saw this case, I'd be concerned that something new is going on, since last year the itching was maybe, more or less not that severe. And then now they're keeping up in the middle of the night. So did something change? Is this dog infected? Has it developed an parasite like fleas or even mites? So I would look for those first, because it sounds like this is more of an acute issue. Like today, it's very bad. And so I would look for, the obvious things first and rule out flea allergy, as well as, or just even flea infestation, and then scrape for mites. And so scabies, of course, is a very elusive mite, and it can be very difficult to find. So if I have suggestive symptoms of this, I will go ahead and treat. So we will do that. And then, of course, they always say, put the fire out. So you need to do something to actually control the pruritus, the itch today, because mom and dad can't sleep. So we would find, based on that patient's needs and what has maybe worked in the past or hasn't worked, I would choose an anti-itch treatment for that dog. So we've got monoclonal antibodies, steroids, oclacitinib, those types of medications work fairly quickly and can provide some relief while you're trying to do those initial diagnostics with ruling out the, potential ectoparasites. And then from there, of course, you always want to check for secondary infection with cytology. I do cytology in almost every single one of my patients that presents with active lesions. And once doing cytology on the lesions, we would determine if there's infection that needs to be treated, if it's focal versus more widespread, whether, this is something we can treat topically. And then really for something like this, I would see what happens first. I probably wouldn't jump to allergic workup yet. And then, get them back in a few weeks. And if the lesions are gone, but the itching remains, then we'll talk more about further ways to treat potential allergic disease. Maybe it's now atopic. If it's a younger dog, this could be the first time ever that it presents with atopic disease. It could even be a food allergy. So that's where, time will tell us. I always tell people, if this is one time only severe pruritus, it could be anything. Yeah. But once you rule out some things and you see what's left over, then we would, proceed further with more diagnostics.
I would also add that, a lot of times clients don't realize that secondary skin infection called secondary pyoderma is very itchy in of itself. Yeah. So when a lot of the mistakes I've had, from seeing other patients from other vets is that they really did a good job of the allergy, but they didn't take care of the secondary infection. So then they're continuing to be pruritic, itchy because of that. And I have found that with atopic dermatitis, it sometimes starts like you said, it started a little bit last year, and then now it's so just like with people allergies, sometimes it can get worse season to season. So I would also ask, was it seasonal? When you said about last year, this year, around the same time of year, that's important. If it's just been going all year round, and I would find out where the dog sleeps. Dog sleep in bed with you? Have you changed, even fabric softener? Have you changed, a new blanket? I've had dogs that were allergic to feathers, right? Yeah. In the pillows. So you never know. It's like that, as Dr. Joy said, one of the most important things, and that's why one of the longest questionnaires that new clients get when they go to see a specialist is the dermatologist, because there are so many nuances that are so important to really determine what it is. And you have to be very specific, because sometimes when it comes to newer docs, the older docs, I would tell you that history is essential for so many of the things that we treat, that when you've been doing it for a long time, and that sometimes you don't need much more than the good physical and the history, and you already can make your diagnosis. So.
Yeah, I absolutely agree with that. It's I like to say it's 50% is the history and 50% is the physical, but in a lot of our skin cases, it's some significant homework that people get before they will go and see people like you, Dr. Joy. But that's because it is so important, and it's a real process. I guess that's what what I'm hearing is that it's a real process to make that diagnosis, but it's so important that we actually make that diagnosis, because it's very easy to, and I'll see this in in forums, is that people will have a very similar situation to Molly, and everyone's saying it's allergies, you need to change the food, we're jumping to conclusions when there's so many things. And Dr. Cherice, I imagine you have calls that are very similar to this as well, with people thinking it is going to be a quick fix, but how do you kind of approach the people that you're speaking to and maybe not seeing?
Yeah, absolutely. First, how do you follow Dr. Joya? Talking about a skin workup, she's the ringer. But to your point, Dr. Alex, we do get a lot of these pet families when they're trying to make the decision to justify, gosh, do I really need to go to a dermatologist for this? Or do they really need to scrape the skin? And so much of what me and my team do is providing that value statement of, here's why that skin scraping is so important. Here's why that cytology is really worth the bang for your buck. And if you get to the point where we're talking about culture and sensitivity, we don't bring that up lightly, right? Because we don't really want to have to do a culture and sensitivity for the skin, because that means the first, second, and third line of defense, third line of treatment has often failed right at that point. And so we're looking for the zebra. We're looking for the hard things to treat at that point. So really, when these pet parents come through on telehealth, the first aspect of it is, number one, you're not alone. This is something we see every day, multiple times a day. And right now, skin is our top second reason. It's our number 2 reason for people to come through telehealth because of exactly what this pet Molly is going through. Dr. Roth, I'm going crazy. She's itching all the time. And really letting them know that, you know what, we get it. We understand the damage that itching can do to the human-animal bond. Here are things that you can do right now, as Dr. Joya put it, put that fire out. How do you stop the itch right now while you're waiting for that appointment? Is it bathing? Is it, if it's one area that pet is really focused on, don't underestimate the power of like cool compresses, right? Those sorts of things to put that inflammation, to lower that inflammation as best you can from home, really does help to empower and honestly try to rebuild and repair some of that human-animal bond. But a lot of what we do in telehealth, especially for these pets that really do have to be seen, is we say, here's what you can expect at that visit. Number 1, you're going to get flea combed. You're going to get a flea and tick prevention. Even if you don't see the flea, it's not saying that it's an infestation. It's saying that there could be a real allergy. When I get bit by a mosquito, I swell up. I am miserable. I get actually physically sick, much to my husband's chagrin because it doesn't make much sense, but it is a true allergy. And so really it's a lot about relating to that pet family and what they're experiencing in that moment. And then being able to seamlessly pass that case. Hey, Dr. Werber, we actually talked to one of your clients at 2:00 in the morning because Molly was itching. Here's exactly what we talked about. Miss Jones is coming in. She understands the value of getting that skin scraping. She is expecting oral flea and tick prevention from you. And oh, by the way, she'd really love some help with the bath. If you could make a local recommendation because Molly is crazy in the bathtub. All of those things that are outside of kind of what we traditionally see in the vet clinic, those pre-decisions of how do you get someone to the point where they can wrap their mind around, oh man, this might be expensive. Is it going to be worth it? All of those things lead up to, yes, Molly needs to go. Here's how we get her there. And here's what you can do in the meantime, because we're all still experiencing, 4 to 6 week wait. It could be weeks before Molly can get in somewhere, depending on where she lives. That pet parent is going to want to know, what can I do right now? Some of that is mousses, some of that is shampoos with real active ingredients in it, all of those sorts of things, so that we can buy them time to get in front of that veterinary dermatologist or to get into that veterinary clinic.
Yeah, absolutely.
Dr. Alex, quick question, because I love the fact that Dr. Roth is working in telemedicine, because we have AirVet as well, and we know what it's like. What are the rules as far as VCPR where you are?
For Dr. Alex?
Yeah, or either one, but I'm just curious to know what, because we have some pretty stringent rules in most of our states. About VCPR.
Yeah, so I guess what you're talking about there, Dr. Jeff, is that we need to be able to make kind of diagnosis and to be prescribing medications.
Right. Exactly.
We need to have it's called the it's a relationship with our clients, and we have to have had an examination of that pet, basically. So from our telehealth point of view, we can provide, I guess, a lot of and it's not something, I'll be honest, that's a huge thing over here in New Zealand, but we would have to have had that examination. We'd have had to have that consultation kind of with the pet parent and with the pet in our consult room to be able to, and I guess it's probably the same with you, Dr. Cherice, how you practice. But that's not to say that there isn't a role for it, and that there's a lot of practical information that can be given. But there are limitations, and there's significantly important reasons why those limitations are in place as well.
Yeah.
Oh, absolutely. I mean, I think that there's definitely the separation of, let's say Molly's family is hourly wage workers, and they work during the day and they can't get in at night. We have to be able to help them justify taking that time off work to go see Dr. Werber or go see Dr. Joya. They have to know that it's worth it, and they have to know and understand what they're getting themselves into and how to help Molly the best. And so, while yes, I won't be necessarily in some states prescribing Apoquel or doing Cytopoint injections over the internet, there are definitely things that are quite practical. They're well within the hands of a pet parent to be able to perform. And frankly, the veterinary industry will have to move forward. There are things that we're missing. There's 4 to 6 week waits. And meanwhile, Molly's on fire. And so, there are definitely things that as an industry, we have to do better with our oath and how we provide care. And that's exactly what I'm here for. So yeah, there are some states that we're a little bit more restricted in what we can recommend, but I am never going to restrict my team from being able to wholly educate around the value of what you can provide in clinic, Dr. Werber, or what Dr. Joya can provide as that next level of care in the hands of a dermatologist. All of those are fair game.
Yeah, absolutely. I think it's important to recognize, I mean, we could probably talk about this topic for another couple of hours, but, you know, to recognize that there are a lot of people struggling out there financially. I mean, there's a lot of vets out there struggling financially. So, I mean, I think that's important to say, because otherwise people will be hearing, well, vets are so expensive and they're just raking it in, which, you know, we're not all driving Lamborghinis, or at least I'm not. So, you know, a good quality care does cost a significant amount of money that not everyone can afford. And even, I guess, if it's just providing a little bit of peace of mind, you know, hey, Dr. Cherice, my dog's itchy, you know, I've seen fleas. Is that going to be the only reason? You know, what would you recommend as the best flea product? You know, that doesn't have to be a consultation with a veterinarian that costs, you know, however many dollars, you know, that is, when it's simply a case of, here's a few things we can do to reduce that inflammation with cold compresses, use this as a flea product that you can get, and, you know, that animal is helped onto its health. You know, and yeah, it's actually provided with some care rather than absolutely no veterinary care at all. And Jed, I guess you see this with your clients as well, that you're, and, you know, the people who are reaching out to you and looking at your products, is that they're looking for, you know, maybe community, they're looking for support, especially when it comes to allergic disease.
Yeah. Honestly, a lot of times when our customers are coming to us, they're kind of more towards the end of, you know, their wits' end. They're looking for alternative solutions. So we, and every supplement company, the first thing they should respond is, have you spoken to your vet? It's a big red flag if you're speaking with a supplement company and they're not bringing up the veterinarian. That's first and foremost. Any of our solutions products should be in addition to, and should work well with what your vet's saying, and your vet should support it. We're going to deep dive into more of the daily activities on our end. We're looking for those anomalies, right? So food, we've mentioned food. It isn't as big of a source of allergies as most people think, as we've already mentioned, but it is possible. Secondly, water, right? The Water Quality Association here in the United States, basically all tap water has 18 contaminants in it, right? Nothing good. So there could be toxins from the tap water. You may just consider trying filtered water for a few months, see if it makes a difference. It's been surprising to me. I personally didn't really believe in that before I tried it myself, and it does actually make a difference. It's important to look at the daily activities. I had a good friend that's like, my dog has allergies. We can't fix it. We can't fix it. We can't fix it. And I really deep dove into it, and I found that he walked the same path every day. And long story short, we finally discovered the grass that he was walking in every day was oversprayed with chemicals heavily. He switched his walking path, and his dog's nonstop chewing and licking of his paws went away in about 2 weeks, right? That doesn't have anything to do with our products. These are just some of the things that we're going to look for. Obviously, once they've been exposed to these things, we want to remove them. We really encourage people to look at these things. Like, for example, mold exposure is a big one. We see our customers, they've done a lot to treat it themselves. They often are detoxing for their own personal results, but they've never considered it for their dogs. Dogs are usually exposed because of their daily activities, their closeness to the ground, everything else, the way they eat, lick, drink water. They're exposed to a lot more than we are, and they deserve that same chance. So we really recommend that if you're looking, deep diving, not finding solutions, toxins and chemicals, and removing them really could be the solution.
Yeah, I mean, there's a lot going on in the environment. I know in New Zealand, like the quality of house is not fantastic on average, and there's a lot of damp houses, and the mold, you know, and allergies to mold are incredibly important components. So actually, yeah, removing a lot of the sources, and it's very difficult, if not impossible, to remove all the sources, but every little bit helps. I mean, I wonder, Jed, if you could talk, because obviously, like Molly, and in this fictional scenario, you know, her parents have, you know, looked for different supplements, and they've, you know, bought a few things. Is maybe you could talk a little bit to how we can ascertain the quality of, you know, production and quality control, and how people can go about looking for supplements, whether that's yours or whoever produces them, to know that they are a better quality product?
Generally, it's pretty tricky. You can always ask for a certificate of analysis. Every supplement company should have that on every product. It contains a report on toxins, heavy metals, any contaminants that might be in that product. I always recommend to people that they ask the history of the company. It's really common to find human supplement companies that have had great success. And in some meeting, they decided, well, why don't we just slap a different label on it and sell it to dogs? It's a pretty big market. So ask them about the history of it. If they say they have scientists or veterinarians on staff, ask for their name, ask for references, and then just the basic, questions you can ask any company to see if they're reputable. But if they hesitate on any step of the way, whether it's references or certificate analysis or the history of their company, it's probably a big red flag. And most pet supplement companies don't have that many unique products. So if you find a company that might be shady, I'd recommend just switch over to one that your vet recommends.
Yeah, absolutely. I think that's some really good top tips. And I guess every company should be very open about their processes and about their quality control. So yeah, absolutely. If there's any reluctance, or it's just, I don't know, or I wasn't aware that was a problem, then look elsewhere, because there are other very good companies doing some very good work with some products that, do really make a difference. So fantastic. And there's some top tips there, Jed. I guess moving on. So we've got our, Molly, she's, we've put out that fire. We've maybe made that, diagnosis of allergies. We've been through that process, whatever that looks like. Or another dog, what can we do help our known allergic dogs settle their itch if they're having flare-ups, to keep them under control? Or what common mistakes do you frequently see pet parents make? Maybe Dr. Jeff, if you want to take this one first.
Well, the first mistake they make is trying to go to Dr. Google and come up with their own solutions. So, I think it's, as I said, trying to get an accurate diagnosis, and it's all about education. And we really need to educate our pet parents, our role, and work with them. I mean, we have to, in a sense, we have to sell ourselves and maybe sell some products and maybe sell some testing. But the most important thing is they believe in us. So we've already established that relationship. And this is where, it might be a little different. Well, when you're a GP, you have the relationship with your clients, and it's almost, when you're doing it for a long time, almost anything goes. But I don't like to be a hard seller. So I like to come up with the horses first. Let's rule some of these things out. Then let's go, if we need to, go to zebras. And even amongst the horses, the most logical things, try to give your clients an option of really what we can do, what might be the best thing. Just at least, as Dr. Roth said, to start off, we have to get things that'll solve the problem, at least the severe itching now, and as simple as bathing, compressing, a right mousse. Just give some, even something like, it's interesting, but I like giving clients game plans. Because Rome wasn't built in a day. We're not going to make the diagnosis and the treatment 100% successful in one visit. Let's try a few things. Let's see what we can do. Let's save this test after we get the results of the first test, and sort of come up with a game plan. And I find clients, when you do it that way, are the most receptive, all right, to letting you work your cases out.
Yeah, absolutely. And I guess, Dr. Joya, my common mistake that I see people make is that they don't stick to that plan. They maybe put out that fire and then think that we're all done, or slowly things start to slide them. So we end up back at square one. What kind of thing are you seeing in your in your practice with your clients?
I mean, it's the same with ours as well. Sometimes I think by the time they come to me, they're a little more invested in the treatment plan because they've been through the scenario over and over again. And of course, I see the worst of the worst. So, but I always tell people allergies are forever. This is not going to be fixed instantly. It's something that's going to require a long-term partnership between you and me, and we need to find what's going to be the best fit for us long-term, because if you can't afford Cytopoint every month, or Loki Vetmab, if you can't afford that every month, then it's not a good fit for us. We have to find something that's affordable and is effective and has as few side effects as possible, because it's going to be a long-term fix. I think when you start to equate atopy in animals to allergies in humans, and you say, well, just like your hay fever, it doesn't really go away. It recurs every spring. They kind of start to understand that a little bit. And then they're like, oh, that's right. I've been on, cetirizine for 20 years now, like once they buy into it and they understand it, that I can't fix it, and that it's a diagnosis of exclusion, meaning that we need to rule out all of these things first, because every now and then you do miss something, and then you're down a whole pathway that you shouldn't be on, and the treatment is not going to work. So most of the time, by the time the patients come to me, they've already had those things ruled out, and they're there for long-term management or for intradermal testing for immunotherapy and just kind of some tweaking. But I do agree with Dr. Werber. Antihistamines in general are not very effective. I think people say 15% at best, and that's if you try several antihistamines to find maybe one that'll work. So in my patient subset, antihistamines might be effective in reducing our need for steroids. They have been found to lower the dose of steroid you may need to use in some animals, but in general, not super effective by the time they come to me. So maybe a very young first time onset atopic, maybe an antihistamine might work that first summer. But as we know, atopy is kind of an evolving thing in animals. And, each year, I think the body starts to create more and more inflammation that evades some of the treatments. And that's why sometimes, a dog that used to respond well to oclacitinib or lokivetmab may not do that anymore. And then you have to switch to something else. So that happens. And you were still trying to figure out more things and studying what happens in human medicine, even though dogs are not humans, and our atopic dogs are a lot different than atopic humans. And it's totally different, but very fascinating to look at the two fields side by side, because there's a lot we can learn from them and a lot they can learn from us, actually.
Yeah, absolutely. And you touch on something there that's very important. I think it's being honest, having that honest conversation, both you, Dr. Joya, and Dr. Jeff, it's important that we have that relationship.
There's no shame in it. If you cannot bathe your dog weekly, like I'm asking you to, I'd rather you be upfront with me now, because I'm not going to prescribe that for you if you can't afford this. And I tell people, immunotherapy takes a long time before it's effective. However, it can reduce the amount of chronic drugs your pet may need, and it may be a more affordable option for you long-term, especially for large dogs. I mean, some of these medications in a dog over 60 pounds it's a lot. I mean, more than what I spend on a lot of things each month. So, immunotherapy is usually a lot less expensive than that. So, and it's safer, so those are really good reasons to go towards that option.
Yeah, fantastic. And Dr. Cherice, I guess, that kind of touches on something we were speaking about a little bit earlier, and the affordability and things, and that we can hear all of these, we've got some fantastic new, drugs in our arsenal that, they do an amazing job, and it's not high doses of steroids that, I grew up with starting, in my career. But what, apart from these drugs, and they may not be accessible to everyone, what are some other, top tips that people can be doing at home that can help? And I guess it's important that we don't over exaggerate the benefits that some of these home changes can make, but they're all really important steps that can help reduce our reliance on drugs, or reduce the frequency of flare, and keep things nice and settled, and focusing on that quality of life.
Yeah, absolutely. And actually, both Dr. Werber and Dr. Joya hit on, even in clinic, I give the same 3 tips for pets that I know have allergies. The first one is you're not allowed ever, no matter what the reason for the allergies is, to skip flea and tick prevention in a pet that we know has allergies. There is no reason. It will set off a whole series of events that are going to be expensive and could be hard to get a handle on. And so never ever skipping the flea and tick prevention. However you get it, keep doing it until it's literally not working, and then let's switch to another one, because resistance is real. The second is actually only agree to a treatment plan that you intend to follow. If you cannot follow it, it is not a plan. If you cannot follow it, there is no veterinary client-patient relationship for that visit. And so what that means is that we are starting back behind the 8 ball. So if you can't do it, you have to say something. And in return, as Dr. Joya and again, Dr. Werber both mentioned, the onus is really on the clinician to allow that out of, is this something that can actually work for you? It's no different from a pet being diabetic. It's no different from a pet having urinary issues. Is this something that can actually work for you and your family? Because if the answer is no, let's change our conversation. The third is get help. This is sounds really simple, but if you're doing all of the things and you're checking all of the boxes and something changes, it could be that something new has happened. And so even if that means, hey, Dr. Joya, I'm doing my Apoquel, I'm doing the Cytopoint, and all of it was cool, and now we're itching again. And so if that's at 2:00 in the morning, don't bother Dr. Joya, come talk to a telehealth provider. But in reality, it could be that there's something else going on. And so don't ever discount that change can happen. And so those are kind of the top three, even in telehealth, that I still tell people and still tell pet families. The number one mistake I would say is impatience. That I love surgery because it is, we've talked about this, Dr. Alex, I like instant gratification, but also skin is a reality, right? And it is ever changing. And there are all sorts of external factors that can change your pet's day to day. Don't get impatient, stick to the plan. And then if the plan is not working, get help so that we can help to tweak it rather than starting over from scratch.
Yeah, absolutely. And I guess, from that long-term point of view, doing something as simple as keeping a diary, keeping a log of, everything that you're doing and maybe how bad the itch is, because with a lot of things that, might be suggested at the vet clinic, or you might, supplement that you might start, it's not going to be an overnight fix. In a lot of cases, I mean, we might be able to put that fire out very quickly, but, the quality of skin is going to take time to improve. So when you're living with your dog every day, it can be sometimes very difficult to appreciate the progress that you are making, or in the same instance, appreciate that actually things are getting worse and you don't realize that until, hey, we've got a real problem and we're almost back at square one.
Yeah, absolutely.
Yeah. And I guess from that point of view, Jed, it's a case of being realistic with our supplements as well, and not expecting, we'll just have a week's supply and, hey, I've seen this improvement in my dog, and it must be because of that, when realistically it's going to have taken, whether that's essential fatty acids, supplements, our kind of omega-3 fish oils, that kind of thing, which really do take weeks, if not months, to kind of make those changes within the body to have an actual real world effect.
Yeah, exactly. Supplements are not a miracle cure. They're not going to they shouldn't be fixing anything overnight. It should be a long-term approach that goes alongside with the plan you make with your vet. That being said, like we've kind of mentioned, keep an open mind. There may be a lot of different sources from these allergies. Could be heavy metals, toxins, parasites, or the more common ones that we've talked about. But really focusing on the entire day and night that your dog goes through. Really check that routine. Where do you walk them? What's the quality of the water, the quality of the food, the quality of their bedding, the quality of your house? Everything they're exposed to plays a factor into their health. And you may be able to do them some big favors and improve their quality of life by making those changes and taking the time to unemotionally look at their day-to-day life.
Fantastic. I mean, that's a great top tip there, and yeah, examine everything. So everyone, this has been a fantastic conversation. I've really enjoyed talking to you all again and, diving into some of these things. We're going to be talking about them in a huge amount more detail in our individual talks. And we've got a load of other expert guests as well, diving into kind of really practical information that people can take home and use to help them understand allergies, to help you formulate a plan that's going to work for your situation, your financial situation, your physical ability, the temperament of your dog, all kinds of different things. So I'm really looking forward to all that information being shared over the next few days. Make sure that you join in the conversation on Facebook as well, because we're going to have various live streams and Q&As and all that kind of good thing. And if you've got questions, then it'll be delighted to see those and answer those. Make sure that you join all of the sessions with a notepad and paper, because you're going to have so much to learn. And maybe just to sign off, I'd love to hear maybe one final closing thought from each of you. Dr. Cherice, maybe first.
Oh, let's see. For me, it is treating a pet with allergies is a marathon. The sprint aspects of it are real, but it is definitely a marathon. So patience is key, and knowing when to reach out for that slug of water or help is number one.
Fantastic. Jed, closing thought for you.
Consider heavy metals and toxins as a possible cause for allergies, and let's get them into the conversation.
Dr. Joya.
Allergies, really, it's a multimodal approach. There is not a one size fits all for each patient. So your veterinarian is there to help find the best fit for you. And it's like Dr. Roth said, it is a marathon. So I'm pretty greedy. So I like to micromanage my cases, and I'm here for any little slip up. So we are in a partnership together. So if we have a time that flares, we're going to fix it, we're going to deal with it, and then figure out how to prevent it in the future. And that collaboration together, I think, is what provides the best outcomes for the pet.
Absolutely. Fantastic. And Dr. Jeff?
I would guess that when it comes to allergies, don't give up hope. It's a long haul. We need answers. Sometimes getting the answers is easier than giving you a solution. But there are solutions out there. It just may take some time. And it's all about patience and trust. And hopefully as a team, we can fix it together.
Absolutely. But there is life at the end, light at the end of the tunnel. There is definitely solutions that will be able to help your dog be comfortable, will help you get some sleep and not be woken up at every hour of the night. Fantastic. Thank you so much, everyone, for your time. Thank you so much for your willingness to share your expertise and talk with me at various times of the day and night over the last few months as well. It's been an absolute pleasure to connect. And yeah, thank you so much. And everybody else, I'm really excited to be talking to you over the next few days. Take care.